Last month, Christina Applegate received a star on the Hollywood Walk of Fame. It was an emotional moment for the 51-year-old as it marked her first public appearance since announcing her multiple sclerosis diagnosis. The actress has been open about the difficulties living with MS. Her story is once again a reminder of the importance of paying close attention to signs of an illness. That's why Bridget is standing by now in today's Ask a Doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
Now, Christina Applegate was diagnosed with MS last year, shortly before her 50th birthday, and says symptoms like numbness and tingling sensations had been happening years before that. Her transparency also increasing awareness about this condition. Joining us this morning, Tracy Carrasco, Orlando Health occupational therapist, and you work with patients in the MS Comprehensive Care Center, which Correct. We're fortunate to have here. Welcome.
Yes, thank you. Thank you for having me.
Well, your work is so important, and when we think about, identifying MS and what leads up to that initial diagnosis, talk about the things that people should look out for.
So the disease itself involves our central nervous system, so that's our center that controls everything in our body. So there are a lot of different symptoms that can occur. They can have things like sensory symptoms, maybe changes to their vision, balance problems, or sudden onset of weakness. So that's when you can start to think, maybe I need to see my physician and see what's going on here.
Right, and you see someone like, someone we're so familiar with, Christina Applegate. She's 51, so young and vibrant, and this actually can start really early on, much younger than that.
Correct. So the most common age range is between 20 and 50 years of age, although we do have pediatric cases as well as people who have been diagnosed in their later years, in their 70s even. But the most common is between the 20 and 50. And that's right at a crucial time when people are really starting families and coming into their adulthood. So it can be quite a shock for them.
Right, and it's shocking to hear those young numbers. When you think about, how people respond to treatment and who might be more predisposed to this, do we understand yet, why people develop this or who's more likely to get it?
There is somewhat of a genetic component to it, but there's also a lot of other factors that they really truly are still studying. We do know that women are more likely, 2 to 3 times more likely to develop the diagnosis. So, but yes, there's still a lot more to learn about who and why would be diagnosed.
So when it comes to treatment and managing everything, how does that work out? Is it medications and therapies? Does it vary from patient to patient?
It does. I think the biggest thing for someone who's beginning to have these types of symptoms is to maybe get in and speak with their primary care physician. Some of our patients might have a very sudden onset of these types of symptoms and might end up in the emergency room and be referred straight on to a neurologist. If they're meeting with their primary care first, they might be sent on to a neurologist to begin further diagnosis. It's not a very easy diagnosis to come about. It involves eliminating a lot of other things that might mimic those same symptoms. So they would need to do further testing involving lab work, maybe spinal fluid assessments, visual assessments, and then they use an MRI to look at your brain and spinal cord to see if there's lesions. From there, you want to make sure that you're getting with someone who's a specialist, a neurologist who is very comfortable in treating multiple sclerosis, because there are a plethora of medications, pharmaceuticals that are able to be taken now, and that's really developed over, say, the last 20 years. So that's the important part. On top of that, we want to make sure that they're getting the right medication for them. So these particular medications are referred to as disease-modifying medications. Because there's no cure for MS, these are important because they do tend to halt the disease or slow the progress down. So that prevents any further permanent damage.
How can you identify it? Do you call it remission, or you said halt it? You can definitely slow the progression.
Correct.
I guess you can't make a promise as
Right.
a patient is, going through the therapy, but it's, a variety of things you try in hopes of stopping it.
Yes, in multiple sclerosis, about 80% of the cases are known as relapsing and remitting. So that's another part of this, that people may have a symptom that will go away completely, and rather than see their physician, they just think, it was they chalk it up to something else, and so they might ignore going to the doctor. So it's important to follow through and make sure that that's not happening. But yes, even on medications, they'll have a remission of symptoms, and that's, again, the goal of the medication is to really slow it down and put them into a more remission state.
Right, and improving quality of life. And
absolutely, yes.
Moving on. All right, well, thank you, Tracy. Great information. Thank you for all you do, and thanks for coming in.
All right, thank you. Thanks for having me.
All right, back to you, Julie.
Bridget, thank you.